Well, hi everyone. Welcome to our webinar this afternoon. You can see that I've changed location, so I've got to a new race course this afternoon. So I hope you can have a good guess at where I am. So we'll just try and get hold of Ben. I'll just look at my computer screen, try and get that worked out. But we've got lots of people joining us this afternoon, which is great, and hopefully Ben can hear us. Can you hear me, Ben? Not at the moment.
Hello.
Hi, Ben. You can hear me?
I can.
Great. Brilliant. Well, that's always a very reassuring start. So very pleased about that.
Good. Can you see me?
We can see you and we can hear you.
Brilliant.
So that's great. Well, look, we've not quite got to 5 o'clock, so let me just sort of introduce to everyone that's logged in what's going to happen. So this week we're holding us a webinar week with trying to go around the industry to talk to different people involved with horse racing. Earlier on today we spoke to Jamie Snowden, who spoke about lots of very interesting things about training and how the current situation has affected his training at the moment. And this afternoon, we're delighted to speak to Ben and get a little bit of an insight into his world. So we've got 40 people joining us at the moment. At the bottom of your screen, there is a button, and if you press that button, you can type in any question and answers that you want. So I'll be passing those on to Ben later on during our webinar. So any questions at all, click on the Q&A button at the bottom of your screen, and from there, you'll be able to ask Ben any questions. So we've got 45 people that have joined us at the moment. I'll just say a few hellos to Alistair, to Alison, to Anne and Rodney, to Brian and Sue, to Bruce and Leslie, to Brian, Camilla, who else we've got? Charlie, Chris, Claire, David, David Reynolds, David Wilson, Debbie Powell, Fiona, Graham, Helen, Jackie, Jane, lots and lots of people. Jennifer, John, Joyce, Judith, great, I could go on forever. Liz, Mark, Martin, Michael from Ireland, brilliant. Pat, Peter, Phil, Rosie, Sally, Sarah, Shane, I shouldn't have started this, Sue, Toby, lots and lots more people. So sorry if I've missed you out, but great to have so many people involved in our webinar this afternoon. It's, I think, been about the most popular webinar we've had this week. So great to see so many people getting involved. Okay, the last thing to mention before we start with Ben is just every webinar I've been visiting a different race course. And today, this afternoon, early this afternoon, when we were with Jamie Snowden, I was at Fakenham. I've gone across the country to a different race course. So have a think and have a guess, and I'll tell you at the end which race course I'm visiting today. So I'm absolutely delighted that Ben's been able to join us. When I sort of thought about this idea for Webinar Week, I wrote down all the things in horse racing that I didn't understand and would like to learn more about. And I have to say, top of the pile of that was the whole concept of breathing operations and veterinary science. And it's something that I have very little knowledge about. So I'm particularly pleased that Ben's been able to join us today, as much as anything to enlighten me about what happens when these horses, we send these horses off to him, and they seem to just keep coming back and winning. So every time they come back, it's like Solstice Star came back and won first time out, and lots of other examples. So whatever he's doing is obviously working very well. So it's gone 5 o'clock, so let's start. So hi, Ben.
Hi.
And just tell us, how are things going in terms of sort of lockdown for you, and you're keeping well and family keeping well?
Yeah, we're very well. I've got 3 children who are out the horror years. They're between 6 and 12, so actually they're quite good company. And actually, it sounds awful, but I've really enjoyed the break. I love my job, but it's a treadmill and you keep running, and I enjoy it, but I do, and I'm never going to stop if there's work to do. So this has been extraordinary, and you know, it's worrying for the people infected. We've had quite a few cases locally. Actually, the school got hit, and some of the parents were really sick. But it's a very strange epidemic because there's such a wide variety of outcomes, isn't there? So but you know, it has echoes of the horse flu last year when there was, you know, big hoo-ha about it with Donald McCain's yard. It's obviously there's no similarity in severity, but you can lock down horses very easily, and you can stop them moving, and you can stop them going out, and you can control these things. Not so with this.
No, we're certainly in a very unique situation, and I think we've all enjoyed, I think, to a degree, spending more time with our families. But, so, can I just talk about sort of families? Can I just ask you about sort of your background, and particularly the influence of your father? I mean, how on earth do you get in? Or how do you become the world expert on horses breathing?
I'm not sure I'm the world expert on horses breathing, but I probably do more procedures than anyone else, and as a practitioner, we're busy. There's some very clever people doing the research which we use, and thanks to them, a lot of the advances have occurred. But my father is 98 years old, and actually lives with us and is very well, and he, after hanging up his flying goggles after the Second World War, when he was a pilot, he went into vet school, became a vet, has been an avid punter all his life, didn't enjoy farm animal practice, and he went against the stream and became a horse vet. And everyone said he was mad because tractors were replacing horses, and post-war austerity didn't mean racing was thriving. Anyway, he did it anyway, because that's what his passion was, greyhounds and horses. And his first boss, chap called Colonel Townsend, who was a career army vet. He and I think it's a bunch of other vets hobdayed all the mules that were used in supplying the forces throughout the Second World War. I think they hobdayed, I think it's at least 2,000 mules at Doncaster Racecourse in the beginning of the war. And my father was a pilot based out in the Pacific Theatre and supporting the troops in the jungles in Burma. The mules were used there. They were parachuted in, and with packs on them to supply the troops. And they were hobdayed for a very good reason, to stop them making a noise and giving away positions, and at the front, at the battlefront. So Colonel Townsend obviously got pretty handy at doing that procedure. My father worked for him for 6 months before the poor chap, he passed away. And but my father had obviously looked over his shoulder enough that he got a head start, and with a sort of racing head, be keen on racing and everything, he decided that rather than doing hunters and show hunters, which is where the wind operations were done, no one wanted a noisy show hunter in showing classes. My father had decided that racehorses might benefit from it, doing the same procedure. And I guess the rest is history. And, I was lucky. I'm second youngest of 5. I'm the only vet. And he was ready to hang up his hobday kit when I graduated. I was lucky I wasn't competing against him, because he's quite a competitive devil even now. So I was lucky, my eldest brother's in his 60s, so I don't think my father would have let him have a look in, really. So I'm 49 and graduated just over 20 years ago, from Edinburgh Vet School, and or massively into horses, whether it's racing or show jumping or polo. I've had a go at everything and ridden in a few points. Worked in racing practice with Buffy Shirley Bevan, who has a sort of big roster of trainers, involved a lot of traveling, worked for her for 8 years. And then we got on very well professionally, but really as a business team, we weren't ever going to be good bed partners. So I left and started my own thing with my wife, who's a vet. And Vicky's worked in horse practice for 20 years as well, and we have a really super team. And I benefited most from assisting my father in Ireland. He used to go to Ireland regularly and do wind operations over there, and I used to go as a student and help him. And he's done, Willie Mullins is a regular client, so we've always had top horses. It's always a thrill to be around the very, very best horses and get to know the trainers and the people around them. And that's how I learned really in Ireland. And then I brought it back, and you know, that's how I cut my teeth. It's always difficult. How do you get your first surgery? You know, there's some poor devil's always going to be, you know, it's the same with humans, you know, that everyone's got to learn. And unfortunately, you know, there's only one way to learn, and that's getting your hands dirty. And learning how to get out of trouble is the secret to surgery.
Well, it sounds like you built up plenty of experience before getting too deeply involved. And what I'd really like to understand, Ben, is what do you do? I mean, really, when these horses arrive on your premises, what's the process? What actually happens?
Well, it all depends on the trainer slightly. There are certain trainers who definitely have a set idea of what they want done, and they have a system that works for them. They might have had their horses hobdayed in the summer, and then they want their pallets fired in the autumn. I much rather make it be, being a bit of a scientist, you know, we'd like to get a diagnosis and act accordingly. But and if given a blank sheet and no information really, we get the horse in, we scope it at rest, we make an assessment. Now, scoping horses' larynxes at rest is fraught with inaccuracy, because a horse's larynx is moving the whole time. And if the horse is laid back and quiet, and horses don't mind being scoped on the whole, they're not like us, they don't have a gag reflex. So we can stick a scope up a horse's nose, and it can stand and look really quite happy. Whereas if we were doing it, we would be wriggling around a bit. So we assess the horse's larynx. If the horse is very laid back, the larynx almost certainly will look paralyzed, because there is a fundamental problem to the blueprint of the horse, in that the wiring of the larynx is asymmetric. The horse's right side, the nerve for the larynx travels straight from the back of the brain, little loop to the throat. And we hardly ever see a problem with the right side of the horse's throat. The left side, which remember has got the heart on, the nerve comes out of the brain, passes down the neck, down around the base of the heart, which is quite a long way in a horse, and then passes all the way back up along the vein back to the larynx. And that is the root of the problem. And that is why these problems are so common. And to some degree, every single horse has a weakness in their larynx on the left-hand side. It's very easy to overdiagnose. So you could scope horses that are laid back, and because of that delay in signal, because of the asymmetry, you will see a sleepy left side of the larynx. And you know, in time you learn that actually they're not all paralyzed. It's a case of you really need to do a dynamic test. So we pass a scope up their nose, attach it to the bridle, and that has a video link to a remote screen. And then we have good facilities here where we can work the horse to a distance commensurate to its race distance. We've got a bunch of decent horses and riders. And what we do is we work the horse over a race distance, and we throw in horses to challenge the patient as we near completion of that race distance, just to try and simulate pushing on at the end of a race. And that gives us the best chance for diagnosis. And at that time, we can attach telemetry to measure heart rate and heartbeat and rhythm, GPS give us speed, and we can download all that telemetry and look at it live with a sort of feed next to the video of the larynx and soft palate, and just see where is the problem in performance, where's the drop off, where does the heartbeat suddenly climb and the speed go down, and does this coincide with anything going on in the upper airway? So we do that, and but the great mystery is as much as we love to be cold and scientific about these things, horses confound science all the time. You know, training horses is not a science, and when you see trainers applying too much science to it, it invariably doesn't work, because they confound everything. And there is a great art to training horses. And I have to say, some trainers really, they just have, I always think the best trainers are a bit bloody minded and can be quite awkward. And they just have an idea of what they want done and where they want to go. And as much as you scratch your head and think, well, absolute lunatics, they consistently outperform. And, you know, I know lots of lovely trainers who are listen and listen and listen. And the ones that are absolutely a little bit closed and bloody minded and they've got their way actually probably do better in the long run. It's quite weird. It's a very strange thing, training horses, and I don't pretend to really understand it. But I do respect a trainer's opinion. They know those horses back to front. They listen to them every day. They have good staff, and their feedback is as valuable as what we see and what we find on our gallop. Because at the end of the day, it's not a race. And a lot of these issues are down to the composure and mental state of the horse. Especially the soft palate problems. The laryngeal problems are more cut and dried. There is a more science to it. There is paralysis, and there's a finite amount of, there's a level of fatigue where the laryngeal muscles just give up, and we see that, and we can decide what we need to do there and then. The mysterious problem that we see is the soft palate problem, which is probably the most common from looking at what we've done for your horses. And that is a tricky one, because you can have a horse that is winning races hand over fist and has a palate problem. And you know, I think I don't think I'm letting the cat out the bag by saying, you know, Sprinter Sacra, he had terrible palate problems, and I think everyone who rode him or rode near him could hear the problems, but he was just never challenged. And these palate problems are very interesting, because you have them if you have the palate problem in a very good horse, they will win a lot of races without trying to treat it. It's only when they go up the handicap and they're pushed out of that comfort zone, and the moment they go from cruising and winning races cruising to actually having to roll their sleeves up, the moment they're challenged, they stop. And then that affects them mentally. They lose their confidence, and then the problem gets worse and worse and worse. So palate problems often you don't see on our gallop. You can work them quite hard, but they're not at the racecourse. They haven't got the same level of mental excitement, and they're very tricky. So when we have a trainer sends a horse and says, look, this horse is choking at the end of the race, jockey says it is, I've heard it, never hear anything at home. With those, we're kind of almost, you can understand why our diagnostic rate is very low for actually finding the problem at our facility. So with those, it's quite common for us to say, well, you know, there's no laryngeal paralysis we can see, everything else looks okay, the lungs are healthy. In the absence of any problem that we can find, even if we gallop the horse and we find no problem, we say, look, in the absence of any problem we've found today, if the horse has a breathing problem, it has to be the soft palate, which is why we probably fire palates and cauterize palates and do tie forward surgeries for palates a lot without concrete diagnosis.
So, but if I understand correctly, if a horse gets a tendon injury, you could argue that has been caused by something, there may be a DNA issue in there, he may have had a weak tendon, but it may have been exaggerated by the way the horse was trained or by the racing that they've had. With wind issues, is it just about their DNA and actually that would have happened whatever, or are these issues sometimes caused by the way they're trained, the way that they're raced? Is there a human aspect that actually causes issues that require surgery?
There is definitely, I think we can, rather than human issues, I think we can say there are genetic issues, congenital issues, which can present at birth or be a tick away like a time bomb and appear later. And we have environmental issues. Now, whether that's people or the training environment or the disease environment, there are definitely those two factors that contribute. Genetics plays a big role. King's Theatre we were very fortunate to set up when King's Theatre was getting going, because by and large, almost every decent King's Theatre progeny had a palate problem. But he's probably the most successful sire of my lifetime. And they were consistently performed well. And we were just fortunate that, you know, we had these amazing candidates which responded really well to palate surgery. But they were brilliant horses. But there was definitely a genetic component to them. And they also responded particularly well to the surgery. They don't all respond well to the surgery. So that's interesting. There's a lot of sophistication which we don't understand, the different types of genetic contribution to the wind. But going back 30, 40 years, I remember my father, almost every other horse he was hobdaying was a strong gale or a supreme leader. And of course, nowadays, everyone, the bloodstock agents pick those out as the dam sires and grand dam sires that they like to see in the pedigree. So, you know, we've got inherited problems before we even started, but they were the best stallions of the time. So there is actually a genetic link between speed, size, and laryngeal paralysis. So you're damned either way. You know, you can try and avoid the bad sires, and there are some horrors out there, which I would avoid, but there's also really good sires with the problem, which you go to and you take the chances. Environmentally, disease is obviously a problem. You know, we do see a lot of palate problems when a yard is sick, and I think the problem with veterinary science and horses and training is there isn't enough money and investment into developing very sophisticated viral tests that we have in human medicine. And when we consistently see, 40 years I've seen horses sick in yards. I remember when David Nicholson had problems and my father was pulling his hair out, and you go through the years, and we had Philip Hobbs had a terrible season a couple of years ago. And I remember chatting to him and saying, look, we won't find the problem. You know, we just don't. We don't have the ability to find what it is, but they will come out of it. And I think the really frustrating thing for trainers when the horses are sick is the worst type of sickness for a trainer is where the horses look well, but then run badly, consistently badly. And there's no test for telling you when they've come out of the sickness other than you run the odd horse like it's the canary. When the canary starts running well, you're away. And then usually they start bleeding as they've got over the disease. After it's almost certainly viral. It may creep around the yard. It might go like wildfire, but that's really tough. And you do get breathing problems after that. So you know, you've got big closed populations where biosecurity is absolutely impossible. And you've got horses moving around now more than ever. So you do have inherited problems and a lot of environmental problems. I think certain gallops will, in young horses, I think if you overface them, they will develop a palate problem because they just give up. There's a mental component. You've got to keep them wanting to concentrate and hold them in a composed way. If you overface them, they give up and they let their palate go. It's like a snoring. It's just total relaxation. If they just relax and give up, or they don't want to do it, they will have a palate problem.
Yeah, no, it's very, very interesting. All the different factors that need to be considered. So, Ben, can I ask you some almost terminology questions? There's some words that you said, and I thought, I don't really understand what that means. So maybe I can throw a couple at you and you can explain what you're meaning. So let me throw 2 or 3 at you. So you talked about scoping. So I'd like to understand what that is. Talked about sort of the Hobday operation, cauterization, tie back. So maybe you could very briefly just give me an idea of what on earth you're talking about.
Right. I don't know if this will work, but I've got a screen next to me with a demonstration of all the different problems. Now, I don't know about the quality. We'll give it a go. We'll give it a go. So bear with me a second. So basically, we'll separate them into two different types of problems. There's the larynx, which is a valve at the top of our trachea, which is our windpipe. And we... Hang on. Oh, you bloody thing. No, it's not going to play ball, is it? Oh, you damn thing. So right, I'll start that for a second. So basically, you've got the larynx at the top of the windpipe. It's a valve. It's got two sides. It should open and close. Should be closed when the horse is eating and swallowing, and it should be. One second, I'm just gonna. Here we go. Got it.
This is great live TV.
Got it. There we go. Yeah. Good. One of my children will come in a minute, and I'll start swearing. Right. Now, I don't know if I can turn this round. Yeah, I can. Right. So this, I don't know, can you see that?
Yes, we can see that. Yes.
Right. So that's a horse's larynx. That horse is galloping flat out. And we've got that's the epiglottis. That's the entrance to the trachea. And then you've got their right side and their left side. So obviously it's their left and their right, not as we're looking. So this is the side we normally see problems with. And this space here is called the pharynx. And there's quite a large sort of hallway entrance to this is about 40 centimeters up the horse's nostril. So in his throat. So that's a normal looking larynx and it's beautifully symmetrical and there's no problem there at all. Right. I don't know just tell me if you think this isn't working. But,
yeah, no, that's great. So that's what we'd look for. That's what we'd want
that's what we all want to see. And now this is a horror because this is this is a really nice Goldwell youngster, bought for an awful lot of money at the Land Rover sales, passed 4 different veterinary tests at the Land Rover sales and was broken in, and they started it going and the trainer said, look, it's making an awful noise, we're really, really worried about it. And it looks quite normal there and looks really good, and at rest the horse looks amazing, doesn't make any noise when it gallops for a furlong, but then it all goes horribly wrong. So this horse is going up the gallop, and as we go, we just see this side here just getting a bit lazy. And then I'll make it a bit more obvious in a second. There we go. This is horrible. See, now the larynx has collapsed all together. And you see we've got a slit to breathe through. That's the windpipe. So this poor horse cannot breathe at all. And the more pressure you put him under, the less air he's getting. And you can see there. And that is the horror story for all of us buying bloodstock, because there is really no protection against this. You know, these are 3-year-olds which are unbroken, and it's clear there you've got a problem. And unless you test the horse dynamically, or you're very experienced and you can listen to the horse, you will not find the problem. So that requires major surgery where we go in. The Hobday is removing these vocal cords, which are just at the base here and here. And these are like a V shape and they go like that. They are the voice box of the horse. So they are used when they call out. When we do a Hobday and remove these vocal cords, which is quite a straightforward procedure, they still have a voice, they just sound different. They're a bit hoarse, no pun intended. So the other issue here is you've got this cartilage of the larynx just collapsing inwards there, here, And what we have to do is artificially open that. And there's several ways we can do that. We can put a nerve graft in where we actually take another nerve and insert that into the paralyzed muscle, which you need to be really quick for that, because you need to have a situation where the paralysis has just occurred or there isn't a muscle left there to put it into. So whilst we like to do that, it's quite rare that we get an opportunity, because you've really got to basically got the horse within weeks of the problem starting. The other thing we can do is we can actually put a stitch in and reconstruct the muscle in a permanently open position. Now, with all these wind problems, small problems can be fixed quite successfully. Big problems often are accompanied with complications. And the tie back, which is where we artificially tie that larynx open, has the complication of it's no longer a valve, and when the horse eats, the larynx is not shut. If you're unlucky, the horse can't compensate, most can, and food will go the wrong way and they'll get a tickly cough, which is fine if you're just hacking around and not under pressure. But if you're a national hunt horse under pressure, you know, in bad weather through the winter, you don't need that sort of handicap. You know, it definitely is frustrating. So I have got a host of different breathing problems, which I can go through, but I don't want to bore you all to tears, or if you want to ask questions and get stuck in that way. But I mean, I can carry on, whatever you want to do.
Well, we'll get some questions off some people, and then as we go through, also very conscious of your time as well. So, so I understand the tie back. Just going on to can you just explain to me about the hob day? What does that mean?
So the hob day, basically, when the horse's larynx is a sort of heart shape, as I showed you in that video. At the base are these two folds with a pocket each side, and that is their voice box. There's a chamber which is, you can fit both your thumbs in when you open a horse up and during surgery, and they act like little pockets of air because the muscles aren't working properly. You've got this problem with the left side of the nerve, this long nerve, and this left vocal cord hangs and fills up with air, and literally like a bladder, it blocks the bottom of the airway, and it's very common. There's often a telltale whistling noise, and often they don't sound very bad, but when you investigate it, you can see there is quite an enormous obstruction, and you've got a very turbulent flow of air. It's not just that you've lost a bit of the airway, it's just you've lost the nice flow. So the procedure that was done way back in the Second World War to the mules is exactly the same as we do now with the horses, where we actually remove the lining of that pocket and we take a little section out of the vocal cord. It's very straightforward procedure, and it's very easy to make a mess of, but it's very easy to do once you've got the knack. And it's there for everyone to see afterwards. You can see it when you scope a horse. So, you know, I think I can probably recognise my own surgery. So when we have horses in from repeat surgery, I can see if I've done it. I can also tell you several other surgeons whether they've done it as well, because everyone has their own way of doing it. So that there's a sort of signature to them. Nowadays, we can do it standing up with a laser, so we don't need to do the anaesthetic. But the laser surgery, which is done standing, is great. The problem with laser surgery, it's burn, not a cut. So the healing is delayed because what you take out, you leave a lot of dead tissue behind. That needs to be cleaned up. It takes 2 or 3 weeks for the body to spit that out, and then healing starts. So in the winter, when a horse needs a hob day and trainers are impatient, we almost always do it with the knife, because healing only takes 3 weeks with a knife. It does require a general anaesthetic, but we do about 2,500 general anaesthetics a year. And well, I can say it now because we're not going to be operating for a little while. But, you know, it's a very bad year if we lose one, and we touch wood, we haven't lost a horse for 4 years, I don't think. You know, whilst everyone gets worried about general anaesthetics, these are very quick procedures. And I think the physiology of horses means the length of the anaesthesia makes it risky, not the actual knocking down and jumping back up. they're like beach whales. If you go on for hours and hours, they do wake up with problems, with muscle problems, what have you.
So that's interesting. We've had quite a few horses that have come in for sort of cauterization, and we often find that happens almost on an annual basis. And they've recently done Carn Top, who came in, who I think you saw 12 months ago. Solstice Stars, another one who almost annually seems to be booked in with you.
Yeah, he's a very regular customer. He is.
Is that normal? And the other question I'd like to know is, if it is, is every procedure as successful as the next, or does it have a sort of less impact every time you do it?
You're right. No, you're dead right. There is a law of diminishing returns, I'm afraid. The problem with soft palate problems is that we can't fix them. We can help them and manage them temporarily, but they inevitably, the issue gets worse. So even if the treatment is working, the underlying problem just, breaks the threshold of where we've helped. And also cauterizing palates, which is the most successful treatment for soft palates, is a combination. It works for a combination of reasons. It works by stiffening up the soft palate. We stimulate scar tissue. The soft palate is a floppy structure. When we snore at night, that is due to our soft palate obstructing our airway and obstructing our larynx. And the problem is exactly the same with horses, but whereas we get it when we're very relaxed, horses get it usually when their threshold of fatigue is broken, and that fatigue becomes so great that the lactic acid in the palate builds up, and for some reason that individual has a low tolerance to the lactic acid, loses control of that muscle, and then it's free and it's flapping about. And cauterizing the palate will stiffen it up. So in the absence of any muscular tone, it's a stiff structure after the cauterization. Now that scar tissue disappears in time. Now there's a huge variation in how long it lasts. It can be 3 months, it can be 2 years. And we can keep repeating it with success, but you will get less time. Hang on a sec, I just need to.
We've just lost you for a moment. Are you back?
Yeah,
Great.
I'm back again. You get less time each time you do it. The first time you might get 2 years. Second time you'll get less. And I think when you're doing it very, very often, you probably only get 6 months out of it. So for that reason, we always say to trainers, look, especially at the moment, got a bunch of horses that were making a noise in the spring. Trainers are saying, what should we do? They're gurgling in their races. And I go, look, we can't do anything much just now. You're not going to be running the horse for a while, unless you're guaranteed it's a summer good ground horse. If it's a winter horse, leave it, and we'll address the problem in the autumn. The other issue with cauterizing palates, which is really interesting, you will sometimes have horses which are really sour, quite grumpy horses which don't eat very well, are very hot and bothered and runaways on the gallop. And it's very curious, but we'll quite frequently cauterize a palate, and the trainer will say, oh, that's brilliant. Horse was a horrible devil before. He's lovely now. Eats well. He's a nice ride. Doesn't tank off with anyone, and he's running better. Why is that? And we don't really know why, but I think we do get rid of the sensation of the palate when we cauterize the palate. It's essentially it's numb afterwards. The horse has motor function, but no sensory function. And I think the palate really troubles these horses. They really get very unhappy about their lack of control. They don't like the feeling of the palate getting in the way. If you take the sensation away, they're suddenly happier. And it's very binary that you do it, and literally you'd think they'd be really sore after the surgery, but they're eating up better in 48 hours, and everyone's wondering what the hell's happened. So it is quite weird, and we're lucky that we have these effects. So that's cautery. That's why we do that, and that's why we think it works, and why it has a finite duration of action.
Yeah, it's very interesting, particularly about, you know, that horse feeling better having had the operation, and you know, I find that absolutely fascinating. And so just, Ben, I think we won't take up too much of your time, but maybe we could grab another 5 minutes, because I think everyone's really enjoying this and getting lots of really positive feedback. So if anyone's got any questions that they'd like me to put to Ben, please just fill them out at the bottom of your screen, and we'll have another 5 minutes, and then I think we better let him go. He's probably got to teach his children something, I expect. So we've had a couple of questions, so maybe I can fire one or two at you. So one here, why is it that horses that are bought at the sales are usually not scoped? Why would you not just scope everything that you buy?
Are you talking about store sales or farm horse sales?
Yeah, I think the question is probably directed towards the example you gave earlier with someone that's bought an unraced horse and then found, you know, very expensively, and then found it had a problem. You know, is that because these problems develop over time and therefore may not necessarily be recognised at the time of purchase?
Yeah, I mean, every year I used to do this betting at the store sales in the Derby sale for Tattersalls, and it's an absolute banana skin, because the vets at those sales are very, very keen to not let anything with a marginal win problem through, because they know it's going to be a stick to beat them with afterwards. Because no one wants to pay 30, 40, 50, hundreds of thousands on a horse, which they then want to sell to owners, and then lo and behold, it's making a noise. So what they do is they are vetted twice, at home and at the sales. They are lunged, and if there is no noise on the lunge, they are not scoped, they are passed. If they are lunged and they are heard to make a noise, they are scoped and then assessed on the scope. Now, the problem with scoping horses blind, so just having a scope test, is that if they are a laid-back horse, their larynx will look paralysed. So you will fail a large proportion of horses which don't have a problem. And you may miss some of the horses which are more uptight. While they're at rest, their larynx functions quite well. But the moment you put a load on them, like that horse there I just showed you, as soon as that horse was broken in and they pushed on beyond a hack canter, that's where they saw the problem. And that horse's larynx is perfect at rest. There's no way you are going to diagnose a wind problem with it until you are galloping the horse with the scope up its nose. So, those store sales probably have about 300 or 400 horses in them, and you could scope all of them, and you'd probably fail 25% of them erroneously. What do? You could argue that they should all have an overground scope on the lunge, and everything should have its tendons scanned and what have you, and its back x-rayed. It's very tricky. Actually, to someone who knows what they're doing, you're actually if I had a choice, if I could assess a horse for you or for myself, and I was told, look, you can either listen to the horse or you can scope it at rest. What do you want to do? I would always choose to listen to the horse, and I wouldn't be interested in scoping the horse at rest. I know the noises I'm interested in are the dynamic noises, and I've got half a chance of picking it up if the horse is cantering on the lunge. If I can hear a characteristic noise, I think I can anticipate the problem better than just looking at rest. A marginal larynx tells me very little. I'd be guessing whether it's a portent of problems to come, or actually that's just a laid back horse and we're not very worried about it. So that's the hard thing.
Yeah, no, that's very, very interesting. Well, let's take a couple more questions before we finish off. So Claire Ratcliffe would like to know, can you cauterize a human if they're snoring too much?
Yes. Yeah. There's a French surgeon who goes to Harley Street. He's made a fortune. And yeah. So I think his catchphrase I've heard him say is, once I've finished with you, you'll be able to sleep with, and anyone will be able to sleep next to you or with you.
Great. Well, and another question, just Q Card.
Yeah.
Perhaps a well-known patient of yours, rapidly improved having been seen by you. Can you give us a bit of an insight as to what the issues were with cue card and what you did to provide such a incredible improvement.
He had something called an entrapped epiglottis, which is slightly unusual. We probably see 3 or 4 a month, whereas pallets we probably see 5 or 6 a day. That is an acquired problem, usually due to some sort of inflammation or disease, like a sore throat or something. Everything gets stretched, and there's a flap of skin that gets hung up over the larynx and literally blocks the larynx off. Now, in Q Card's case, it was interesting because I think lots of vets had looked at him because he'd lost his form for a year or so beforehand, and he never showed the problem until he was galloping. And because we have the facility to examine them at exercise, we did see it at exercise. Most of the time, these entrapments are apparent at rest. So anyway, that was something that we actually did him standing. We removed the entrapment. We did it with a forceps up his nose and a laser. Colin was keen we got on because he wanted to run him at Aintree, and it literally was Cheltenham week, more or less, or just before Cheltenham, and he didn't run at Cheltenham. I think we all took turns riding him out, which was great fun. It was nice to have these good horses here, because Colin was very keen that we didn't miss a day, but he wanted to leave him with us to make sure everything was going the right way. Yeah, he ran well at Aintree. Following that, I think he was second at Aintree, ran really well, much improved, and then won the King George later on in December. So that was great. And entrapments can be, they're quite good. We like them because you hope actually you are going to get that 1 stone improvement, which you sometimes can with them. I mean, I'm happy to take questions for another 10 minutes if you want. I've got no particular rush to get back and start cooking.
Well, in that case, let's keep going for a couple more at least, because I'm sure everyone's really enjoying this, and people can always leave if they want to. Another question we've had, I'm just sort of reading it as I pass it on to you. So, do you think the number of issues is increasing, or is awareness of those issues is increasing? A trainer's much more aware of breathing issues, and therefore you're seeing more horses? Or do you think there actually is more of an increase in those issues? Does that make sense?
Yeah, I think what's really interesting from watching my father operating 30 years ago, everything needed a hob day then. And the pallet was quite an unusual problem. And it's flipped around now in that, the pallet is, at certain times a year, we are seeing so many pallet problems. Now, there are definitely genetic components to be said. There are certain stallions that have a lot of pallet problems. But I think the massive change in the way horses is trained and the amount they move around and the bugs they catch, I think the environmental side of things is a big contributor. And we are in a rush with young horses nowadays. These horses are under pressure, much younger. A lot of horses, if we see on the flat, 2-year-olds, almost all of them have palate problems, but they will grow out of them. Everyone's in such a, there's so much money involved. People are quite impatient. Trainers feel under pressure. There's no doubt that if we're in too much of a hurry, we will see more palate problems that we hadn't seen before. Martin Pipe changed everything by galloping horses up a hill, doing interval training. He changed the whole scene. I've argued with him about it, that he's responsible for the whole palate problems. He doesn't agree. No, I don't believe that it's true, but is it contributing? We don't know. I think a lot of people are changing now to putting in circuits and deep sand gallops. We have got a deep sand gallop. We've had no end of trainers wanting to visit in a socially isolated way to examine what we've put in, and so they can copy it. It's interesting. I mean, it's something we can't really answer because the one thing you can't have, my critics in the vet profession say, well, studies say that a lot of these problems are going to get better anyway. So, you know, your surgery isn't helping, it's just time. And I said, right, that's fine, but you're never going to have a control to experiment. You know, no one is going to say, fine, I'll just leave my horse gurgling every day and choking, and we'll see what happens if you can treat it. So because these horses get treated, and thankfully, touch wood, a lot of them respond, that's the way things keep going. In the perfect world, you'd have a control group within the yard of horses that are gurgling, compare them to the ones you're treating, and say, right, let's shift environmental things around. Let's change ventilation, feed, different types of exercise regime. But we can't do it because no one wants to sacrifice their horse in the name of science and that sort of progress. You know, it's all going to happen now, soon, and we all want to run our horse. So it's tricky, and I think there are definitely environmental factors involved. And I wouldn't be surprised if the interval training, the amount horses are moved around and the bugs they encounter, which are far greater than they were before, and the fact that we're breeding from a lot more smaller, flat horses, rather than the sort of big lumbering staying chasers, which we probably saw more of, you know, in the last 50 years. So I don't know if that answers the question or just makes it more confusing.
Well, I think a bit of both. No, well, I think it's fascinating, isn't it? And those environmental factors. And I know that David Smith just sent a question in about, you know, running on different gallops and services, and very much what you were just talking about, and saying, you know, what are these environmental factors? And maybe we'll look back in a few years and think, crikey, you know, why were we doing it that way? And we'll be doing it a different way. It's interesting, when we do our stable visits, you know, we've definitely seen a change, as you say, towards not actually running these horses up a hill every day. Even likes of, you know, Richard Newland's put a new gallop, you know, much flatter than it was. Going to Ollie Murphy's, Dan Skelton's, these round gallops where the horses are working very hard, but it's not uphill. And I think there is definitely a shift and a change in the way these horses are training. And it'll be interesting to see if that has an influence and an effect on, you know, the problems that you're seeing.
Yeah.
So, but just to finish off, I've had lots and lots of people sending in a question which goes like, can we see another video?
Yes.
Is that possible, just to finish off
absolutely.
with? Because I think everyone enjoyed that. So let's finish off with another video.
Okay, well, so I will show you two types of palate problem, which are bugbear. Right. So here we go. I'll just turn the screen around. Right, so there's not much to see there. Doesn't look too bad. I'll forward it on, and now the horse's larynx is being obscured by the palate. Now, if I slow it right down, you'll see the floor there. That's the palate there. The floor is coming up and obscuring the airway dramatically. And laryngeal problems, the horse doesn't really know about it. It's not under any conscious control of the larynx. It's automatic. This is under their control, and they really don't like this. They get very distressed. They get worried about exercising, and you can see there is no airway there. You can just see a tiny bit of the larynx poking out there, and that's all the horse has to breathe through there. And that is what we call a billowing soft palate. Now, so that's the most common problem we see in heavy ground, national hunt staying horses. And, you know, that they can make a very, very rough noise, and they're usually always quite upset about it. Now, there is another type of palate problem. 1 second. So this problem is more in flat horses and horses that are going very quick, and they look absolutely fine. And then there. And then you can see, if I go back a frame, you can see here the epiglottis, this triangular bit here. This is where Q-Card had his problem. So that is his epiglottis. It's like a funnel, funneling air into the airway. And you can see it clearly there. And you should be able to see it. Now, when this horse's larynx, when its palate displaces, which it will do in a second, any moment now, there. Now you can no longer see the epiglottis. The palate has obscured our view and has overridden the base of the larynx. Now this is a very, very different problem to the billowing palate. And there you go. So this is basically not quite so bad as the billowing palate, but and that requires a different type of surgery where we actually tilt the larynx away from the palate, and that's something we do much more this time of year than in the winter. So I don't know if hopefully that answers the main difference between palates and then we have exactly the same. If we snore, that's what's happening. The latter case there.
Well, Claire will be very pleased to know about that. Now she understands what's going on.
We're good.
Ben, thank you very much indeed for your time. I really do appreciate it. I know you're extremely busy at the moment, so we're very grateful.
I'm just going to go and cook supper. That's what I'm delaying.
Well, we really do appreciate your time, and thanks so much for all your work with our horses. Unfortunately, I think they probably come to visit you a bit more regularly than we'd like, but we're very grateful for all your hard work.
Well, good luck with them all.
Ben, thank you very much indeed. And thanks to everyone that's joined us. We've had nearly 50 people have stayed with us for the duration of this workshop, so that's absolutely fantastic. So well done to everyone, and I think it's been absolutely fascinating. I hope you've enjoyed it as much as I have. Just very quickly, where am I? Well, you may have guessed it's dried out here. I'm at Worcester this afternoon, so at Worcester, and tomorrow I'll be somewhere else. So well done to those of you that guessed correctly. Tomorrow we've got 2 webinars. So 2 o'clock, we've opened up a webinar with Dr. Richard Newland. So we'll be talking to him about a few of the Foxtrot horses he trains, but also about how he selects horses to buy and about his training methods. So that'll be very interesting. And then our webinar week finishes at 5 o'clock with Paige Fuller, who'll be talking about her experiences as a jockey and how the lockdown has affected her. So really looking forward to tomorrow. Thank you everyone for joining me, and thank you again to Ben. Been absolutely fantastic, and take care. Hopefully we'll see everyone tomorrow.
Thanks a lot. Bye-bye.